Hello and welcome back to the Cancer and Ayurveda podcast, where we explore the intersection of modern oncology and the traditional system of Ayurveda. I'm your host. My name is Radhika Narain, a student cancer researcher and an Ayurvedic counselor. Today, I'm very thrilled and delighted to be speaking with Dr. Jeffrey White. He's a distinguished leader in integrative oncology and currently serves as the director of the Office of Cancer Complementary and Alternative Medicine at the National Cancer Institute in the US. His career spans a remarkable breadth from he's done lab research in immunology and molecular biology. He's led clinical trials in leukemia. He's treating cancer patients, and even guiding research and policy now at the Office of Cancer and Complementary Alternative Medicine, or the OCCAM. So, without further ado, I will delve into today's conversation. Dr. White, thank you and welcome. You've had such a multifaceted career. I'd love to start with your story. Can you please take us back and share how you first became interested in cancer care and research, and what first drew you from a conventional oncology path into the world of complementary and alternative medicine? Was there a defining moment or an experience that made you realize the potential of this field?
Certainly. Well, thank you for inviting me to do this. I'm happy to talk with you and to your listeners and viewers. And I think this is an area of great interest of mine. So I'm certainly happy to be participating. Um, Actually, what is interesting? I mean, in undergraduate, I was an engineer. And so I was studying physics mostly. The degree is applied in engineering and physics. And as I was at Cornell University, but I had a long-standing interest in nutrition. And I used to read nutrition a lot. And turned out a friend of mine told me, how come, do you ever think about, doing something with that? I mean, you always read that. You never read any engineering in your spare time. So that was sort of a light that went off for me. It's like, yeah, that's true. And so it actually is what led me into medicine, to explore medicine. And so I finished my engineering degree, had to get things that I didn't have toward that degree, some biochemistry and organic chemistry and biology, and was able to get into medical school after doing that. And so it's really the origin of that. And along with nutrition, I have had a long-standing interest in Eastern religions and philosophies, and sort of that also was part of my great interest. So I went through medical school with just the regular kind of very limited exposure to nutrition and zero exposure to traditional medical systems. We are talking about the 1980s, just to put it in some perspective. So hopefully it's better now. But anyway, and then after that, I did my training in internal medicine. And towards the end of that, I decided to go into oncology. My oncology interest actually does date back to medical school, when I did some cancer research, laboratory-based research. And so I maintained that interest, and then went into in oncology and hematology fellowships at the Washington Hospital Center here in DC. And then toward the end of that, this long training, I decided, I knew that I'm interested. I like patient care, but I really was interested in research, and decided to come to the NIH. I got exposed to that by a contact. And so at NCI, I came to NCI in 1990, and there did the research that you mentioned. And in 1992, the NIH opened the Office of Alternative Medicine. So it's the precursor to what people now know as the National Center for Complementary and Integrative Health. So it started in 92, and I watched that develop. And then in 95, I went and met the then director of that office and started doing some consulting work with them for alternative medicine for cancer-related issues. And then now NCI, the Cancer Institute here, decided around in '97 they need to have at least a person that dealt with these issues. I was known to have that interest, and I was asked to start this office, and that's the end of that story.
Okay. Yeah. That's quite interesting how your journey from physics evolved into oncology and now into complementary medicine. So, for those who may not be familiar with the work that your office does, because it has played a unique role at NCI in shaping how complementary and alternative medicine is studied in cancer, could you please explain the role of complementary and alternative medicine in the context of cancer, and then introduce what your office does and its mission and how it fits into the larger work of the National Cancer Institute?
Sure. Yeah. So even going back into, I won't make it quite so long, but back into '92 when the NIH first started to think about having an office that dealt with alternative medicine. I'm told that at that time there was thought about putting it in the National Cancer Institute, and because a lot of the interest that was coming, from the general public, this was basically a decision of the Congress to have that office started, Office of Alternative Medicine. A lot of the contacts that were coming to them were about cancer. So, but ultimately they did put it in the office of the director of the NIH and not the NCI. But anyway, it tracks back a long-term interest. And the Cancer Institute has had, demonstrated the history of CAM here really goes back in the 1930s when people were doing, unconventional cancer therapies and approaching NCI asking, are these things, do they have any, real legitimacy to them? And that carries through, into the subsequent decades. But anyway, all the way up until 1997, 98, when this office was started, which was really again, because of that interest that was being demonstrated, the need for good quality information products on these issues, these very diverse issues, and coming from reputable resources and reputable sources, and having and developing an evidence base to show whether or not things were effective. So, NCI had been involved in supporting research on vitamin C and hydrogen sulfate, hydrazine sulfate, various other kinds of compounds. So what our office is to do, what we were designed to do, is to try to help the institute address these kinds of issues in a variety of different ways. And so we are now in the Division of Cancer Treatment and Diagnosis, so that the research portfolio that our office supports is more along those lines, mostly the treatment-related things, laboratory studies, and clinical studies. So we have a grant portfolio of a variety of things that are diet-related, herbal products, or natural products that come out of those kind of compounds. And but also we still maintain important function with regard to information production. So we continue to do that along with the NCI's Office of Communications. So we have a grant portfolio. I need to point out that when you look at what the NCI does on this large field of complementary and alternative medicine, it's way more than what my office does. My office is small. We have 5 full-time. We have 7, full-time employees and a contractor. But the portfolio of NCI has things that relate to complementary and alternative medicine in multiple divisions: in Division of Cancer Prevention, Division of Cancer Control and Population Sciences, these big divisions. In my division of Cancer Treatment and Diagnosis. So the research is not all centralized in this one office. It's a lot of work that's going on.
Okay. Thank you for answering that. I'm pretty interested about the evolution of complementary medicine. As you had stated, it started long back in the NCI. So I'm curious about knowing what modules of complementary medicine existed back then and how it has evolved now. Um, and then, like, being someone who's at the intersection of oncology and traditional medicine, you've also probably encountered, you've collaborated a lot and probably encountered maybe skepticism towards practices like the traditional systems and Ayurveda, etc. You've engaged with the biomedical community, and people often label some systems like Ayurveda as pseudoscience. So, why do you think this skepticism exists, and how there can be more trust and meaningful collaboration built around this? And how can we bridge both the fields of modern science and traditional systems like Ayurveda?
Yeah, well, those are important questions. So, the early days of the history of NCI's involvement in complementary and alternative medicine was, the best that I can tell, just looking back at the records, it was not about traditional medical systems, but it was really about practices that were, the very diverse kinds of practices that were just out in the general public, but were being put forward by sometimes physicians, MDs, but other people as well. But if you look at really they're pretty diverse, but a lot of them are diet oriented interventions, and or natural products from herbal medicine. Like an interesting one was supposedly derived from a Native American herbal culture. It produced a compound called Essiac. That's the name of it that was given, by after it was modified or whatever and brought into the general public's awareness. So it was those kind of things. A lot of very, very diverse, but high dose IV vitamin C. I mentioned that, and some other things. Okay. So, traditional medical systems, in the United States, I think people focused a lot in 1971 when President Nixon, went to China and China opened up, and now we started getting a lot of interest in those kinds of things, and acupuncture became an important, topic. And you can see some of the development, that took a couple of decades before the NIH started picking up on it. And so it was there was a large scale conference on acupuncture in 1997, I think it was. So it started, that kind of a thing. And so I think you started having this exposure of people that were in the traditional medical research and practice world to these concepts. And you start getting research that was being published in English language, and in the literature that these folks would be able to read, and scientists start to develop some interest. But you're right, that skepticism has always been there, and so the challenge really that I see is still one of, and particularly if you want to go to Ayurveda. So Ayurveda's one big challenge is that even though it has this tremendous capacity, particularly with regard to training of people in India at the level of, that would be considered very similar to the kind of, the amount of training that they have to go through, very similar to what a physician in the United States or in Europe would go through, many years of exposure. Yes, certainly the systems are different and all of that, but they're academic. They have a basis in their own literature. Now, they don't have much of a basis in the kind of clinical trials or laboratory-based science that modern medicine has. So those systems, traditional Chinese medicine, Ayurveda, the disconnect is the kind of evidence that's used for the most part to support them. And so there still needs to be a bridging between the worlds of the modern biomedicine, I'd say, and those traditional medical systems, because we generally do not have a lot of exposure. We, meaning biomedical folks, don't have a lot of exposure to those concepts and to the literature. And when we do experience those things, the evidence that is provided is not the kind of evidence that we're used to. So, I think, I think though, it is largely just the fact that there's not enough closeness, there's not enough opportunity to communicate.
Just to follow up on that, do you see the skepticism shifting in the recent years? And what do you think the younger scientists and clinicians are they or can they play a role in bridging this gap?
Yeah, definitely. Yeah. I've seen it in particular. So our biggest connection internationally has been to China, actually. And so we had, for many years, we supported a program that brought over Chinese physicians. These are traditional Chinese medical physicians that also had PhDs to work in laboratories at NIH, here at the Cancer Institute. And so young folks that have all of the traditional Chinese medicine background, but also this a PhD, research-based degree. And the experience of the folks, the lab chiefs that in these labs that they've worked in, when I've talked to them, they're happy with it. They feel like, yes, these people understand science, and they work well in our labs. And so it's not like a total, paradigm shift that for them from a scientific point of view. They do so that shows the capacity to have that kind of connection and the dialogue. And yes, when I've talked to these younger folks that have come over, they have, I think, they're quite English literate. The folks from China, all of the people from India that I talk to are English literate. And so, the one thing I'd say about in Ayurveda is that, and we haven't really tested this out, because that the capacity after COVID, the capacity to start to have folks come over and to do that kind of work, it was just before COVID that we started making the connections with the Ayush, the Ministry of Ayush in India. Okay, so we have not had that experience of bringing over Ayurvedic physicians, but I'm not sure that there's as much of a base of people that have Ayurveda training and laboratory PhD level training in Ayurveda. So I like to learn more about that, and I like to promote that to happen in order to increase the chances for collaborative research.
Yes. Thank you for your insights. I think, the potential of promoting some cross-training programs here at the NCI would open up a lot of avenues. So you've had a lot of engagement with international scholars, and I was reading that you had an India-US workshop on traditional medicine in 2016. And so I had questions about that workshop. How was that significant? What were the key outcomes or any directions that emerged from it?
Sure, yeah. Right, yeah, that was the first thing that we did was in 2015, some representatives from Ayush came to visit NIH. So that was our opening up of our communications. And what derived from that was the 2016 meeting in Delhi. And it was a pretty high level meeting. I mean, I think we had ambassador, the American ambassador there. We had representatives from many institutions in India. We brought over 4 researchers from the extramural community, meaning the folks in academic centers here in the United States. And it was a very good 2-day meeting. And so, as I say, it's the very beginning of our connection. What came of that was an article in the Journal of Global Oncology that summarized what went on in the meeting, and some of the recommendations that came back with regard to training, for example, was one thing that came out when we were just talking about, how to try to advance opportunities for exchange of scientists between the two programs. Things about natural products development with regard to quality control, and things about clinical trials design. So a variety of ideas, are summarized in that article. The process that developed from that after that is basically, partly because of the challenges of the distance and time zones and so on, and the changeover of representatives in the Ayush world. Took a little while to reconnect after a while. But basically it has spurred us to continue to have this dialogue, and it also advanced my interest in trying to do explorations in the United States about Ayurveda, what is happening in the United States on Ayurveda. And my biggest interest is really in the integration or the collaboration of Ayurvedic practitioners and researchers with biomedical researchers. And that's why, I know we'll talk about the surveys that we have done. That's what's led us to do that, to try to demonstrate the level of interest on both sides.
Yeah. So coming to the surveys, what are some of the key insights that came out of the surveys, and particularly about managing the effects and symptoms? And how did these practitioners view collaboration with modern oncologists? Were there any findings that surprised you? Did you notice any common ground that they had?
Yeah. So it was a very good experience, I'd say. So we went at this. We had my office has done a couple of surveys prior to this about complementary and alternative medicine, but it actually had been a few years since we've done that. And again, though I had a lot of interest in the topic, I did not have any kind of deep connection in the Ayurvedic community in the United States. And so, we needed to, in order for us to connect, we needed to make those connections. And so that was the first process of reaching out to the organizations and letting them know what we want to do, why we want to do it, what we thought were the benefits or potential benefits for both the biomedical community and for the Ayurvedic community. And that was a wonderful process. I've met so many people, well, almost all virtually, and also attended some conferences. But we asked them, and everyone we asked was willing and actually helped us to get the survey out to their memberships or their contacts. And National Ayurvedic Medical Association, the biggest organization, was extraordinarily helpful. And and it was a result of the work of those folks that allowed us to get 321 Ayurvedic practitioners, well, self-identified Ayurvedic, we call them Ayurvedic professionals, to go the full range of the different kinds of level of education. And 321 answered the survey. It's an online survey. Out of those, so the very first question is, have you ever practiced Ayurveda on a person in the United States? So only 199 of those 321 answered that yes. And so that's what we have. We have data on 199 people that answered that. And best I can tell, this is you could say it's the second maybe Ayurvedic survey in the United States published in the medical literature. There's one about dental health, but it's certainly the first cancer one. All right. Well, it's not published yet, so hopefully it will be published soon. Okay, so what did we find out? Well, we learned a lot about the diversity of these practitioners, of these professionals. They're from 35 different states. Most of them were born in the United States, but we had several that were from India, several that had BAMS or MD Ayurveda degrees. We had a few that were MDs in the biomedical MDs. We have nurses. We have social workers that have this training, and so very diverse. Interesting thing that I didn't really understand, and I should is the degree in which how many patients these practitioners see. So on average, the average is relatively low it's something it's something around 25 or perhaps less patients or clients per month. And so, which suggests to me that they're mostly not full-time. This is not their full-time activity. Anyway, now to get to your question about the symptom management and so on. The kind of questions we asked there were, broad questions. We asked, what are the kinds of things that you think your Ayurvedic practice could do to help cancer patients? And what's been your experience? I think we asked them, not just sort of theoretically. And again, their experience with cancer patients, I should say, is relatively low. 1 to 2 cancer patients a month. Most people less than 50 cancer patients in their careers. Okay, so anyway, but all right, they basically thought that all kinds of things that they've been able or felt that they could do, they could improve the various aspects, pain control, fatigue, GI distress, gastrointestinal distress, a variety of things from prevention to symptom management in people that are undergoing cancer therapy. But these questions, they're just, we did ask them, what kinds of things do you think, if you had to design research on this, that was going to best describe how Ayurveda could help in prevention or symptom management or treatment, what would it be? That part we're still sort of analyzing, because this is a full text of these. We just let them write whatever they want, and it's very different kinds of opinions. But I guess it's safe to say that they thought that there were lots of things that they could do in Ayurveda with Ayurveda. We asked them what kinds of contraindications might there be for using Ayurveda in someone that's undergoing cancer therapy. We got answers to that about some specific herbs and some other things. And when we asked them about their level of communication with their clients, biomedical practitioners, is very low, right? Because they generally don't talk to them, as you could probably imagine, but they would like to. And so anyway, there are lots of things there that a lot of interesting findings.
Okay. Thanks for elaborating on that. One of the points that you mentioned was the communication between the patients and the providers, and you being a physician yourself and also having a background in complementary medicine would understand it better. So what is the limiting factor? Why? Because this communication between the patients and providers is very critical, but it's often limiting. Why do you think these conversations matter so much? And what are the biggest barriers preventing the patients from having these conversations more openly with their oncologists?
Yeah, yeah. I think they're critical, and I don't have really clear evidence, but I do think that it's improved over the past 10, 15 years, the extent to which this discussion happens. Um, it used to be that the majority of people did not discuss their use of unconventional therapies with their oncologist or even with their primary care doctor. But I think that's gotten better, although there's still at least, I don't know, I mean, if you were to do a survey today, I wouldn't be surprised if you found at least 25% of people, 30% of people that don't disclose that. And the when people have asked in previous studies, why have you not disclosed this? It's around, just concern that one is, doctor doesn't have much time, and I'm concerned that they will think that this is silly, or that they look down on me for doing it. Um, I don't think that the doctor knows much about this topic. Those are the kinds of things that will come out. And doctors, I think, ask more now about whether or not people use, or if it's not the doctor, it's someone in the doctor's office that's taking in information about what kind of dietary supplements you use and that kind of thing. Maybe not so much what kind of other practitioners do you go to. But I think that does happen more, getting some of this information. But in the actual face-to-face dialogue between doctors and patients, I don't think it is as common as it should be. And I think it's critical that those things be discussed. There can be, I mean, there certainly can be adverse effects, from certain kinds of interactions of herbs and drugs. Um, some of that's theoretical, but there are, some real situations in which this can be problematic. And at least to be, just to be upfront about what is happening, and just to know what's going on with the patient. When you see some, like, an abnormality happening in the laboratory, results that you get back on the patient, let's say their liver functions tests go off, and you know you don't know what that is. You think maybe it's some drug that you're using, but maybe it's something that they're taking. It there are hazards that can come from it. But that's for those kind of things. But there are other things. I mean, I think, just what are the needs that the patient has that are not being addressed by the therapies that you're providing. Cancer fatigue is a good example, or neuropathy. That the pain or the nerve damage that happens with chemotherapy. Lots of different things for which we don't have very much to do. That we can do to help. Just to hear from the patient. I've been suffering with this, and I just haven't. I need something to do. So I've been doing, this. I think those dialogues are, they, and, again, from a research point of view, they open up, opportunities to explore, those things from a research and study designs.
I think you've highlighted a very important gap. And the basis of that gap is trust and understanding, and maybe the lack of evidence from the perspective of medical practitioners, and the lack of confidence and trust from the perspective of the patients who might be interested in these modalities. So, for some of our listeners who may be students, scientists, or clinicians, themselves, many are open to learning about these complementary medicine systems, but they aren't sure where to start. So, what guidance would you offer them to begin in the field and approach it both with rigor and responsibility? For example, like some of the common mistakes that the researchers should avoid when approaching traditional systems, and and how can scientists, for example, ensure that they respect the cultural context while maintaining rigor when they approach these fields?
Yeah. Wow. Okay. So sources of information for for clinicians, for biomedical clinicians with regard to traditional medical systems. So, well, we have, although there's not a lot of it is about traditional medical systems, but it's about complementary and alternative medicine as a broad topic. The NCI has something called the Physician's Data Query, PDQ. PDQ is an online resource that summarizes the literature on a variety of different topics of mostly interventions. Well, PDQ as a broad thing is for conventional medicine. For so you can have we have an adult cancer PDQ about all kinds of different cancer information. Pediatric one, we have a symptom and management one, and so on. And we have one that's on integrative, alternative, and complementary therapies. And so in that one, which I used to be the head of that editorial board, we have summaries of literature on a variety of different herbal approaches and other dietary approaches, acupuncture, aromatherapy, many different things. So I think that's a good resource. It's a well documented and referenced resource on a lot of these topics. But the topics are so diverse, so many. I mean, they're so that it's hard to cover everything. When you really get to something like traditional Chinese medicine as a whole, or Ayurveda as a whole, I think there are few resources. There's a very good book I believe, on Ayurveda that is from an American psychiatrist. His last name is Ninivaggi, Ninivaggi, Frank Ninivaggi. It's an excellent book because he's an MD who did supplemental training in Ayurveda, and he's able to write it in a way that respects greatly the Ayurvedic history and the evidence and things that are there, and to translate them very well. So that's the best thing that I could think of as a textbook. But basically, I think when you're a practitioner and you have a patient and you have a specific situation that you need to learn about, I think unfortunately it's a big challenge, and if it's a simple single herb, you may be able to find it in the natural medicines database online. But if it's an actual regimen that a practitioner is doing, it's a challenge. I can't really. It's hard to really guide somebody, but but it's best if you can, as much as you can, open up the line of communication to your patient and possibly to the practitioners that's doing this. I think you're doing the best that you can for your patient.
I think that brings me this important concept of integration of these systems into the conventional care here in the US. Do you foresee any of the complementary training programs being mandatory for doctors or professionals so that they can learn more about it in the foreseeable future?
Mandatory, probably not, but I think a lot of people are have the level of interest that leads them to seek it out, electively. And I know some that have gone to the University of Arizona's program, integrative medicine program, and have gone fully through that program, and have been able to utilize that in their practice. I know of an oncologist at MD Anderson Cancer Center who's taking Ayurvedic program. I believe it's at Maharishi Institute, Maharishi International University. But these are elective type situations in which someone just has an interest and they will take the time and the money to do that. Integration into the actual general medical education. I don't really see that on the immediate horizon, not in depth kind of ways. Maybe a specific university might find, for example, Georgetown University has a master's program in integrative medicine. Now, but that's not, the medical students would have to, it's not part of their actual medical training. It's there, it's part of the graduate program there, but they would have to figure out how to work that in. George Washington University, has a track in the medical school. It's an integrative medicine track, so you can get a concentration of exposure in various aspects of it. So I think it's happening in sort of spotty ways, and I guess it'll be like that for the foreseeable future.
What do you think about integration at a broader scale? From your perspective, how can evidence-based traditional medicine, whether in India or the US, be better incorporated into the mainstream cancer care?
So in actual care, so one big drawback is that this is in the United States, Ayurveda is not a licensed profession. Okay, there's no state in the United States that licenses Ayurvedic practitioners. So although Ayurvedic practitioners or professionals can certainly function legally in those states within certain bounds, and the thing that I think restricts the actual integration into care is certainly the licensing, the absence of that. And I think it is, that the lack of an evidence base that provides a comfort level because again, when we're talking about integration, we're talking about, a sort of like a team care approach. So if you have a MD who's caring for a patient and that patient has, let's say, an Ayurvedic practitioner that's working with them, for it to be an integrated approach, those two practitioners have to be on the same page. I know people use the term integrative medicine just as a patient that goes one place and goes another place, and those two people don't know. That to me is not integrated. So for integration, you need to have this. You need to have real communication, and respect of between professions, so that that everyone is above board working for the patient. And so licensure certainly would help with that. That's the main thing that I could see. But I really think you get to that level by research. You get to it by developing evidence-based, as you said. The evidence for us, evidence-based means published research findings. Okay, and right now, if you go into PubMed, you search for Ayurveda and you search for cancer together, and you limit it to clinical trials, you essentially find nothing.
Yeah.
Right. So there's essentially no evidence base of the sort that would be looked for to legitimize that kind of a collaborative activity. So that's what's needed. And I think the United States is Europe is actually my understanding, I'm hoping to learn more from what's happening in Europe, because it seems to me that there are places in Italy and Germany in which some of this is happening, not so much in cancer, but but medicine, biomedicine, and Ayurveda, in academic hospitals, having really developing relationships and coming together. So I think that's what's going to be needed to develop the comfort level for collaboration.
Yes, I'm happy that you pointed out about the PubMed search and the publications that are available for these kinds of studies. Um, I think there is a lot of evidence on now coming up on acupuncture, aromatherapy, and some of the herbal supplements and dietary supplements that you also talked about. But the other modalities like meditation, let's say, or the constitution of a person, that is very integral in Ayurveda, you don't find any evidence on these. And clinical trials need to be promoted, but the first step would be in doing lab-based research to create enough evidence that goes to a clinical trial. The patients get insurance for these therapies as well. So that's a major limiting factor as well from the patient's perspective.
One thing I'll just throw in, because you mentioned something important, is the let me be sure, it sort of almost jumped out of my head, but it has to do with the idea that, so you build this trust, you build this collaboration around the development of evidence. And I think, so we've talked about the challenges. One of the things that in systems of medicine, like Ayurveda and traditional Chinese medicine, is that, if you look at the literature that the West, you would say, if, biomedicine produces on those things, is normally, it takes a component of those things. It'll take acupuncture, not even the whole system of acupuncture. It'll take a very specific aspect of it. When it looks at herbs, the challenge of a combination of herbs is generally, not well looked upon in research. Even a single herb is of, what the kind of models for research are generally molecular, right? So it was what is the active component of that herb? And so when you search PubMed for Ayurveda, you'll get you get some things, and then you look at it, and it'll say this herb comes from Ayurveda, and they looked at this molecule that comes from that herb. Well, that's not research on Ayurveda. So the full component, the diagnostic components of Ayurveda, and the full, the use of it as an entire kind of system, that is a bigger challenge than, that's the biggest challenge, to keep it intact. But I think it's important to try to work our way to that eventually.
Yes, that's a very big challenge, and I don't know how it'll happen within the conventional or the modern scientific framework that we have. But that's interesting, and it's very hopeful that we are starting to tread on those paths.
Mm.
So before we close, for those who are inspired by this conversation and want to learn more, where can our listeners find information about OCCAM's work, ongoing research, and ways to get involved? For example, for a person like me, a student researcher who's also passionate about Ayurveda and about integrating these two fields, like what is OCCAM open to collaborations with international institutes or early career scientists? Or are there any upcoming initiatives or workshops that we can keep an eye out on?
Yeah. So the website that we have, so our website's undergone some change recently, and so there's been a consolidation of the websites in our division. But you can still find that information if you go to, I'll give you the URL. It's DCTD. That's our division, Division of Cancer Treatment and Diagnosis, .cancer.gov. Okay, so that's our division's website. And if you look on that website, there's programs in the navigation bar. And if you go to that, then we're under there. We're one of the programs, Office of Cancer, Complementary, and Alternative Medicine. So that's one place to go to try to get information about what we're doing. But we are going to try, so we maintain this strong interest in Ayurveda. I mentioned the one survey. We have almost wrapped up a second survey, which is one about institutions. So Ayurvedic institutions, so academic and professional organizations. And we asked them various questions focused on research. So the academic centers, so do you have research in your as part of your curriculum? If it's do you have full courses on research, or do you have extensive discussion about research in any of your courses? And are those courses elective, or are they mandatory, or whatever? And so, does your academic center do any research? Do you collaborate on this research? Is any of that cancer research? So we've asked that, and then where do you get funding for your research and all of that? So and then on the professional organizations, we also ask, okay, how about do you have an interest in research, and in what kinds of ways do you demonstrate it? Is it part of your conferences? Do you have research aspects there? Is it a newsletter, items, or a variety of different things? And again, do you fund any research, and do you participate in any collaborative research? And so the goal there is to try to take that along with the professional survey. So I didn't really actually say what's the purpose of these surveys. The surveys are really to publish them and to raise awareness in the U.S. Biomedical community, about Ayurveda's presence in it, and so what is it, what's happening in the field of cancer, and so on. And then ultimately, the level of interest in research, 88 or 86% of people who responded to that survey said that they were interested in participating in collaborative research. All right, so there is a high level of interest. 30-something percent, 37, I think, percent had already been involved in some research. All right, so this is so it's there. So, but it's to make it more well known that there is a community of educated, interested practitioners in this system that want to collaborate. And then the institutional survey is, again, okay, you have training happening, you have professional organizations supporting it, and so all of that is just to build more impetus, for this kind of to support that kind of work. So that's what I'm hoping to come out of this.
Okay.
I'm sorry, I didn't finish. Well, yes, I did. I told you dctd.cancer.gov programs, and they're there, right? So, and so if we do things the way that we've been doing it so far, we've been presenting at NAMA conferences. We presented at the NCAM conference a year ago, I guess it was. We presented at California conference, California Ayurvedic Association. So we're going to continue to be present in the community. So it shouldn't be too hard to find out what we're doing.
So thank you, Dr. White, so much for coming to our podcast today and sharing your insights with us. This conversation really highlighted not just the importance of research and evidence, but also there has to be mutual trust between patients and practitioners, the power of dialogue and collaboration in shaping the future of these complementary modalities and cancer care. So thank you and have a good day.
It was my pleasure. Thank you.